But since chiropractors use manipulative therapy, let's at least take a look at this for a second. The question I have is, who has done most of the research in looking at the use of manipulative and manual therapy in the treatment of musculoskeletal disease, including low back pain? Who's done it? You guys have, the vast majority. And the newest evidence, the best evidence that we have for good outcomes with manipulative therapy in the treatment of low back pain involve the use of the clinical prediction rule, or being more selective in your patient criteria. Who's been exclusively responsible for that? You guys, absolutely, not them. The chiropractors, do they have any interest in this? They probably do. I believe they're probably already using this to talk about it and point to the success and the legitimacy of it. But do we really think that they are using this, the clinical prediction rule, and appropriate patient selection criteria in their practice every day? No way. No way. Their whole idea is to manipulate, remember, anybody and everybody that walks in their office. It doesn't have anything to do with meeting certain criteria or even having an ailment. If you're in the office, you're going to get manipulated. So I think it is fair to say that it is at least questionable of whether chiropractic has a benefit in the treatment of musculoskeletal conditions. Now, when we jump to non-musculoskeletal conditions, I believe that I am, as a medical doctor, a little more qualified to comment, and so I'll say a little more about that. When we're talking about these conditions, what are we talking about? Well, I go back to my favorite document, this job analysis of 2005, and here's a survey that was done in 2003 of conditions that chiropractors encounter in their office. Things like high blood pressure, sinus conditions, allergies, spinal stenosis, dizziness, diabetes, PMS, thoracic outlet syndrome, ear infection, pregnancy, asthma, ALS, acne, fracture, incontinence, BPH, anemia, murmurs, kidney stones, and hemorrhoids. Folks, I will tell you flat out, without question, there's not a shred of scientific evidence that says that chiropractic can help in any way with any of these conditions. It just can't. It just flat out can't. So again, in summing this up, I think we're being generous to say that there is questionable benefit at best for chiropractic with any condition. And that's our summary of benefits. Now, what about the risk? What about the concerns? Well, I've got several specific concerns, including their education and clinical experience, chiropractic pediatrics, and lastly, upper neck manipulation. Regarding their education, folks, I've already mentioned there's 18 schools currently in the U.S., not a single one affiliated with a major university. Their faculty members have marginal academic backgrounds. Most of these folks don't have college degrees. Some of them didn't even go to college at all. Standard curriculum includes 0 hospital experience. Their students are frequently responsible for recruiting their own patients. No postgraduate education for all practical purposes, and their continuing education focuses largely on weekend seminars that emphasize practice-building techniques. What about their admission requirements, folks? The CCE, the Council on Chiropractic Education, requires 90 undergraduate hours to get in. This was increased from 60 in 2002. So they're just now having their first students that graduated with more than a junior college background. And until the 1980s, they didn't require any college. So most of these folks do not have a college degree. Some of them have no college or very minimal college. Minimum GPA 2.5. My gosh, no entrance exam at all, none, no interview. And the thing that blows me away the most there is virtually a 100% acceptance for anybody that can satisfy these meager requirements. Pretty scary, pretty scary. Chiropractic pediatrics, in the interest of time, I'm going to jump ahead and say the thing that scares me the most about chiropractic pediatrics is what I found painted above a classroom door in Davenport, Iowa when I was there a few years ago. Look at this, folks. Vaccination and inoculation are pathological. Chiropractic is physiological. Folks, there's no argument that our public system of childhood immunizations, vaccinations, is one of the greatest public health measures that's ever been implemented in the United States. And these wackos are out there telling naive and scared young mothers not to have their children vaccinated. It ought to be a crime. It ought to be a crime. Okay, in wrapping up, talking about risks, and I'm running out of time, neck manipulation. Upper neck manipulation is a relatively rare but well-documented cause of vertebral or carotid artery dissection and stroke. The majority of victims, sadly, are less than 45 years of age, mostly female and otherwise healthy. Upper neck manipulation, folks, is utilized by chiropractors to treat everything from low back pain to HIV. Several of the victims that I work with, and many of the victims are dead, so I'm working with their families as a victim's advocate, were being treated with upper neck manipulation for low back pain or even knee pain when they sustained a stroke or died. Informed consent is considered unnecessary by most chiropractors. For those of you not remembering your anatomy, the most likely source of a vertebral artery tear occurs when the vertebral artery crosses the body of the first cervical vertebrae and changes from a vertical to a horizontal course. And for those that say that this is hype, that there's no evidence, there is absolutely a body of scientific evidence pointing very clearly to the link between upper neck manipulation and vertebral artery dissection and stroke. Differentiating between upper neck manipulation as performed by chiropractors and performed by physical therapists. Again, I'm a little bit out of my league because I'm not an expert in this, but what I have been able to learn and observe is that the primary difference is patient selection. We talked a little bit about that when talking about the clinical prediction rule. Chiropractors will twist everybody's neck. They love manipulating. They particularly love manipulating the upper neck. So it doesn't matter what's wrong with you, you're going to get manipulated. I don't think very many physical therapists are going to utilize upper neck manipulation as their first mode of therapy on the first day a patient comes in. The techniques, and again, this is just a layperson observation from me. My observation is that the techniques utilized by physical therapists and osteopathic physicians utilizing manipulation are more gentle and controlled than the violent and uncontrolled manipulations often used by chiropractors. Again, informed consent, the chiropractors have no use for it. And regarding incidents, my colleagues and I in Canada that follow this have personal databases of hundreds of victims of stroke following neck manipulation, and to my knowledge, in our cumulative databases, not a single one was caused by a physical therapist. They were all caused by chiropractors. There's no doubt that it's happened with physical therapists, medical doctors, and osteopaths. There was a study a couple years ago out of Germany that looked at a number of incidences of stroke, and many of those were caused by other practitioners. But again, in our databases here in the U.S. and Canada, we haven't seen it. We have yet to see one by a physical therapist. Neck 911 Network, and sort of try to wrap up, folks, an organization, a volunteer organization that I'm a member of. It's just mainly a few physicians, some attorneys, journalists, and mainly victims that are devoted to stopping the senseless deaths and severe permanent injuries that arise following chiropractic upper neck manipulation. Again, we've got a database of hundreds of victims, a number of websites that various organizations have, all kind of doing the same thing. What are the things we do? We do a lot of things. This is my favorite, this bus. There's actually 2 of these buses running around the streets of Connecticut, and this is just driving the chiropractors crazy. But this is just sort of the thing we're doing, just grassroots advocacy, trying to let people know that you better be careful when you go to visit a chiropractor. How have they responded to our effort, the pressure we've applied to them? They've done a number of things. I'm just going to kind of skip through. One positive thing, they did publish this monograph a couple years ago, 2005, I believe, called Current Concepts in Spinal Neck Manipulation and Cervical Artery Incidents. Very scientific, very well done. I applaud them for that. I'd like to think that our pressure has led to them taking this seriously, because they did bury their head in the sand for way too many years. My favorite thing that they've done in response to our pressure was in August of, I believe, also 2005, in their most widely publicized periodical called Dynamic Chiropractic, they named me on the front page above the fold chiropractic enemy #1. So they're not very happy with some of the efforts that I've made. And then in rounding things up, folks, I opened the talk by asking the question, what is chiropractic? I'm going to ask it again, and this time I'm going to let a chiropractor answer it. Sam Hamala is a retired chiropractor in Panama City, Florida. He published an article in 2006, just a little over almost 2 years ago, in Clinical Orthopedics and Related Research, a respectable orthopedic surgery journal. And here's what he says. Chiropractic is not easily defined. Chiropractors are perceived as back specialists, but few chiropractors specialize in the treatment of back pain. Most use spinal manipulation as a method of restoring and maintaining health. Folks, that's just what I said, more or less. So thank you, Sam, for backing me up. The future of chiropractic, gosh, I don't know. I mean, could they become evidence-based practitioners of manual therapy? I doubt it, because they don't want to be. That's not what they want to be. They want to be primary care physicians, but I don't think that's going to happen, because they're not. They just can't be. Wellness doctors, who knows, or could they become extinct? I think that's partly up to you guys, because you guys are the real key to applying the pressure. Future of chiropractic, this was published in the same periodical, Dynamic Chiropractic, by a chiropractor named Craig Liebenson in 2006 also. He says, our academic isolation is a major hurdle for us to overcome, as is our undying support for practice management models that do not emphasize evidence-based care and may even be unethical. I wish he'd have just said flat out are unethical and he'd have been more accurate, but I give Craig credit for that. Another future of chiropractic, back from Hamala in the Orthopedic Surgery Journal. Hamala says there are no indications that the profession will voluntarily limit its scope of practice. It seems that instead it will choose alternative medicine, which offers a broad scope of practice, continued independence, and a way to avoid becoming a subspecialty of medicine without change leading to proper limitations and a better image for the chiropractic profession. Future chiropractors may find it difficult to compete with physical therapists who offer manipulative services. I love Sam Hamala and how right he is. If you haven't seen this, and I promise I'm almost done, The Future of Chiropractic Revisited 2005 to 2015, and you can get this, a web version of it. You've got to read this. This is hilarious. Folks, they are scared to death of you guys. There are dozens of comments and quotes like this one right here throughout this document. It says, a recent trend towards more consumer-directed healthcare could be beneficial to chiropractors, but there will be more competitors looking to expand, blah, blah, blah. The biggest competitive threat will come from physical therapists. I love it. You guys scare them to death. Again, it's just chock full. There's a couple more. I'm just going to skip through them and wrap it up. Folks, in conclusion, it is my belief that chiropractic, this is a slide that I didn't update, in 2007, 2008 remains more of a philosophical belief system than a healing art. Again, I call it a cult. The evidence of benefit for chiropractic, in my opinion, and please tell me if I'm wrong, is weak at best. I'm being generous, I believe. The hazards and risks, on the other hand, are significant and well documented. And lastly, folks, in my opinion, that which is useful and good about chiropractic, and that would be manual and manipulative therapy, practiced responsibly and safely, can and is provided by well-trained physical therapists like you, ladies and gentlemen. Thank you for your attention. I'd be happy to answer any questions if you have any.